High-quality data is of paramount importance, and here the GUIDE project assumes a particularly influential role. Longitudinal data is crucial for contextualizing the statistical information available through Eurostat and national statistical authorities. We require a comprehensive survey on the situation of children's rights in Europe to gather and publish longitudinal data that delves deeper than existing statistics. The survey should focus on individuals below the age of 18 and encompass various factors, including poverty rates, household surveys, early childhood education and care, participation, school assessment results, and mental well-being. Only with such in-depth, intersectional data can we effectively assess the effectiveness of government and EU programs, and gauge the overall well-being of children across Europe. In Eurochild, we have been working for many years to advocate for better data, to help decision makers design better policies, and subsequently allocate more funding for children in need. Now let me share a few examples. The Data Care Project, which is run in partnership with UNICEF. Eurochild is working towards establishing a comprehensive European data system for children in alternative care. The project's goal is to promote the commitment of all European countries to assess the outcomes and impact of shifting from institutional care to family and community-based care for children. Eurochild has taken a significant step in this direction by advocating for an indicator within the Child Guarantee, which tracks the proportion of children in various forms of alternative care. Now, the Child Guarantee National Action Plans. So, Eurochild has conducted a thorough analysis of all the national action plans available on the European Commission's website. The analysis sheds light on the services and support that each government is focusing on, and the data used to identify children in need. This analysis proves to be a valuable resource for Eurochild's members working at the national level. The monitoring framework of the Child Guarantee offers a significant opportunity to advocate for more comprehensive and varied data collection concerning children, as well as for the more effective use of this data in shaping policies and interventions aimed at enhancing the well-being of most vulnerable children in European societies. First year's First Priority campaign, Eurochild, in partnership with ISSA, is leading a Europe-wide campaign centered on early childhood development. This campaign is a collaboration with civil society organizations in 11 European nations to advocate for the inclusion of early childhood development in public policies, with a specific focus on marginalized families and children. Despite the consensus on the importance of a child's early years for their lifelong development and well-being, there is a significant lack of data, especially for children under the age of 3. Now, with regards to inclusive participation, Eurochild recognizes the crucial role of children, families, and communities in shaping policies and actions. It is important to prioritize the involvement of children as they are experts in their own lives. Eurochild's efforts have made them a leading force in promoting child participation in Europe. And we are pleased that the European Union now requires child participation in its funding programs and considers it a top priority in its child's rights strategy. Eurochild, in collaboration with the Council of Europe and its member organizations, has played a key role in developing child participation indicators, which are part of the Child Participation Assessment Tool, used to assess governments' effectiveness in implementing meaningful child participation. In summary, there needs to be a three-pronged approach for effective action to address the needs of children. We need to work together, the European Union, national governments, and civil society organizations. Then we also need research for an evidence-based approach to ensure targeted policy development and then the practical implementation of whatever is needed. There is also the need for a triangular approach to participation, whereby children, families, and communities are necessary to be involved. Comprehensive and comparable data is necessary at the country and European level to inform policy making and public spending, or rather, public investment in children. We need to make the case for improved data, focusing on children below the age of 18, building on well-being comparisons and policy work in Europe. We need to strengthen nationally collected statistics with academic rigor and skill at contextualization, which in turn will lead to more informed policy making.